Welcome to another episode of the Wealthy Podcast. I'm your host, Shauna Nyrose, and today we are talking about topics that I think almost all of us care about: acne, aging, skin cancer, and more. We are joined by Dr. Dianne Burrows, who's a board-certified dermatologist and the founder and medical director at Interior Dermatology Centre. She is an absolute wealth of information. She's also a joy to talk to, and she helps us deconstruct all of the myths and all of the truths around skincare and aging. Did you know that your skin, the body's largest organ, is not just a reflection of your health, but also a window into your future? From the acne or eczema that can shake our confidence, to the sun damage that increases our risk of skin cancer, to the fine lines and wrinkles that tell the story of time, our skin is constantly speaking to us. But are we really listening? On this episode, we are doing just that, literally going skin deep in all the good ways with Dr. Dianne Burrows. Dr. Burrows is a board-certified dermatologist and the founder and medical director of the Interior Dermatology Centre here in Kelowna. You're dying right now, aren't you? She's like, oh, just get through it.
I just keep reminding myself that the video is on you right now.
Yes, it is.
I'm not on camera.
So Dr. Burrows also serves as a clinical instructor in the Department of Dermatology and Skin Science at the University of BC, and is the primary investigator in several exciting clinical trials, which I'm very interested to hear about. So we have lots to talk about today. So let's get at it. Welcome, Dr. Burrows. Can I call you Dianne?
Of course.
Okay,
yes.
awesome.
Thanks for having me.
It's so great to finally have you. Dianne and I have met off podcast and in real life, and she is an amazing dermatologist and has lots to offer. So I'm going to start at the very beginning, roll back time, because most of the guests, in fact, all of the guests that we have sitting in that chair, come to us having a passion for healthcare. And obviously you do. And I'd like to know, where that came from. When did you start sort of dreaming that maybe you wanted to become a physician, and how did you get inspired to become a dermatologist, and maybe an early experience around health or healthcare that informed all of that? Take us back to little Dianne.
Little Dianne. Well, little Dianne actually had chronic ear infections.
Oh.
And so when I think of when did I first have an awareness of healthcare or interest, it was like my banana medicine, up late, watching movies with my mom with really bad ear pain in the middle of the night.
Oh, no.
Yeah. And so I think, I was otherwise very healthy and had an uneventful health issues in my young life.
Yeah.
But I actually wrote about that in some of my medical school applications, because I think that was, when I first thought about it, or started thinking about health. And then I was raised in a very health aware family. Like, both my parents were always exercising and talking about physical health, and we were very, there was no sugar cereal in my household.
Me too.
I remember when we got older, my brother bought a box of Lucky Charms and hid it behind the door in his bedroom, and it was our secret stash. So definitely always an awareness of that growing up. And then when I was kind of a teen and in high school, I started playing competitive volleyball.
Mm-hmm.
And then I ended up playing for University of Toronto. So through that journey, health became, it wasn't that I was sick or unwell. I had the odd injury, but it was more how did nutrition and exercise and sleep and all of these things impact my performance? And so that is kind of when that became really important to me too.
Yeah.
And then
were you always really interested in the sciences?
Yeah, I went into life sciences. Both my brother and I are actually physicians, but there are no physicians in the family.
Oh, interesting.
My mom was in medical sales and in healthcare, and kind of always I think talked about how she wished she had tried to go to med school because she had that interest as well. So I don't know if that like kind of planted a seed in both my brother and I.
Interesting. And what does he do?
He's a family doctor.
Okay.
I'm from Ontario originally, so he's in Prince Edward County.
Okay.
Yeah, so I think that kind of, I don't know, like lit the fire, started the spark of that. And then it was always on my mind going through school. There were times when I thought maybe it would be out of reach because I was playing varsity sports and then trying to carry a course load, and that was hard. But, you know, even within my undergraduate degree, like I would take, you know, there's like the core things you take to try to get into medical school and write your MCATs. And then, but I also did like nutrition and physiology and some sports stuff just out of my personal interest as well.
Interesting. And good for you. I always love talking to people that did the varsity sports thing in university because, as you know, my son is also, he's playing football at U of T, and it's a lot to manage. Yeah,
it is.
You know,
you become very good at time management.
Yes.
Lack of sleep sometimes and performance, like physical performance and like mental performance with not much sleep, which I think sets you up for medical school and residency very well. And then it was actually through varsity sport that I ended up in dermatology. So
interesting.
I had no interest in dermatology whatsoever. I mean, pretty much nothing. I thought I would be a family doctor or a gynecologist when I started medical school. And then it was in my first year of medical school. I was back in Toronto for the summer. I went to Queen's for medical school. So I was back in Toronto. I was looking for a summer job, and through my U of T network, got connected with another varsity volleyball player who was ahead of me. And so she offered me a summer position, and that was a dermatologist. So that was my kind of like first experience with research. We published a paper together, did a presentation. And so, that's kind of how I got interested after the summer. I was like, whoa. And then I was like, oh no, this is a competitive one to try to get into. It's like when I got into med school, I was like, I'm done. I'm like done with competitive sports. I'm just going to chill. I'm going to have this like nice low stress. And then I was like, okay, I'm going to have to start planning electives and all these things. So,
and it's a really broad specialty, actually.
Yes.
When I was doing the backgrounder for this, I was like, wow, there's so many things that we can talk about.
I think that's one of the other things that drew me to it during medical school. So first year wasn't really on my radar. And then when I did the work with Dr. Scott Nicky in Toronto, then I was like, okay, started thinking about it. And then I also really loved surgery, love surgery a lot. So I had a bit of a crisis in third year medical school where I was like, oh gosh, should I be doing plastic surgery? Because I was just, I found it very, I don't know how to describe it, but it kind of reminded me of like competing when I was doing procedures in surgery, because you're so hyper focused that you don't think about other things. So like your day-to-day stressors, all that stuff kind of like melts away because you're just in the zone. So I was like, oh, this is very good for my personality as a former athlete. And I kind of had a bit of a crisis, but then I was so busy on that rotation and exhausted. And I knew that, I hardly talked to my now husband when I was on that rotation. I had no sleep. I didn't have time for exercise. And so that was kind of like, it's like, I need a more balanced.
The tipping point.
Yeah,
totally. And I've heard that. That it's important to think about those things when you're choosing your specialty. We talk to a lot of physicians, and that balance is a factor to consider, right?
Which they don't, honestly, you don't really focus on in medical school. Quite the opposite. They kind of are just follow your passion within medicine. And so, luckily I feel like I had the insight to realize, I wasn't cooking. I love to cook, and I just didn't have time. So I was like, I don't think this is going to fill my cup down the road. Yeah.
Well, we're certainly glad that you chose the specialty that you did, because you're amazing at it. So I thought that we could kind of start off a little light.
Yeah.
Maybe a little game, true or false.
True or false is not light for physicians. It's like I'm too close to my exam that this will bring back a little bit of PTSD, but We're not being marked on this.
Okay,
So that's
no, you're
fine.
not being marked on it. And you can be like a true but or
Yeah.
false and,
Okay.
you know, I'm not that rigid to it.
Okay.
So, or you could just be like, I did this with a physician on the last episode, and she was just like false, false, true, false. So you do it however you would like to do it.
I feel like there will probably be discussion around some of these. So, okay. I'll commit to an answer and then I'll explain myself.
That's
How about that?
totally fine.
Okay.
It's your podcast.
Okay.
Okay. So there's a lot of myths around skincare.
Yes.
And so that's kind of why I want to do this. So true or false? You only need sunscreen on sunny days.
False. So, from personal experience, when I was when I was in my teens, I played beach volleyball competitively as well. The worst sunburn I ever had was on a cloudy day, and everybody got just toasted, and I will never forget that. And now, obviously, I understand the science of it. It's like, have you ever seen those pictures of truck drivers or people who worked in an office and only got sun on one side of their face, even though it was through a window? So same idea with cloud cover. Clouds filter out some UVB, like window glass, but you still get a lot of UVA, which is what breaks down collagen and like leads to signs of early aging, and also is cancer promoting. So it's not just, it's not just me saying like, I want everybody to be wrinkle free. It's like also the skin cancer piece.
For sure.
And you still do get some UVB. So yes, you still need it.
So the moral of the story is wear sunscreen
All the time.
All the time. Okay. I have more questions about that.
Okay.
Actually.
Yes.
Okay. So second one. This one. Popping pimples makes them go away faster.
You know it's going to be false, unfortunately, for everyone listening.
Boo-hoo.
I know it feels good in the short term. I think dermatologists even, I think we all like have some desire for pimple popping, and as you know, with Dr. Pimple Poppers, taking out cysts is one of the small joys in my life.
Satisfying.
But yeah, no, obviously it's hard for like everybody pops their pimples, but it can actually make it slower for them to recover when you do that.
Okay.
Part of that is you're traumatizing the skin, so you're creating more inflammation. You're also potentially introducing bacteria or allowing bacteria to spread to other areas of the skin, and maybe increasing the risk of scarring.
Okay, so do you just leave it?
You just leave it. It's the best thing. You can try spot treatments. There's so much stuff now. I feel like pimple patches. There's all kinds of pimple patches.
So are those good?
Those
pimple
are good. Yeah,
good?
The most common one is like the hydrocolloid dressing.
Yep.
So those are good. They have some now, I think, with salicylic acid in them. I feel like they're trendy even. I've seen them in shapes. Like they have like little hearts and stars. It's like socially acceptable to wear pimple patches. Yeah.
I saw somebody and I thought it was just like part of their outfit, like they had stars. I was like, oh, okay, that's kind of
or you can put it on overnight if you're not into the patch during the day. Then you can do it overnight. But
so don't pop your pimples. Put on a pimple patch.
That or like there's like spot. You can do spot treatment with like a topical retinoid or benzoyl peroxide, that type of thing. Resist the urge.
That's not fun.
I know.
Okay. Drinking more water cures dry skin.
False. It will help. Like adequate hydration will help keep your skin hydrated, but it's, it takes a village to hydrate dry skin. And some of that is from the inside out and some of that is from the outside in, creating a good skin barrier. In patients with eczema, their skin barrier is not as robust, so they're going to have more transepidermal water loss. So we need to kind of like lock it in from the outside in a way too. Okay.
And you're going to help us unpack the world of skincare products.
Oh, yes.
Later in the podcast, because
that needs its own podcast.
It really does. And it's very confusing.
Yeah.
But I feel like you're the person to ask about that. Okay. This is one for all of the ladies that are in my phase of life, but maybe earlier. I don't know. Botox is safe and non-toxic.
I would say true. Which is funny because Botox is botulinum toxin, and the word toxin is in the name. It is a toxin, but it is approved for use and safe. I would say it's safe when obviously an experienced provider is administering it. in an appropriate dose. You're not going to get the toxic effect like you would in like botulism. But it is still a toxin, but we use it at levels that are not affecting us systemically. You know, I've been asked that question before, and it's interesting because I'm like actually quite like a very natural person. I do Botox for myself, but it's like my one guilty pleasure, I think. But, you know, even something like vitamin D is not a toxin, but it can be toxic. Vitamin A can be toxic.
It's the dose.
So exactly. So, and then it's kind of the opposite with Botox. It is a toxin, but we use it at levels that are not toxic.
All right.
That's what I tell myself anyway.
There you go. You heard it right here, folks. I just also want to say too, I get Botox. And one of the things, and I'm not going to get all like soapboxy about this, but one of the things that I think, like, why do we hide these things as women or anybody really? You know, you want to talk about radical self-care. For me, that means like being fully transparent about like, I do have some interventions. So there you go.
I feel like that's changing though. I feel like I do too. People are way more open about it. I feel like Botox kind of like has had a moment where it's almost been like cool to say that you do it because you're being honest, right?
Yeah. Good. And
the other thing about Botox is, you know, like we use it for medical uses as well.
Right. Migraines.
Like, correct. Yeah. Hyperhidrosis, excessive sweating, like certain muscular diseases, like if we need to relax muscles, and people who have like, you know, the neurologists use it. It's not just us.
Right. Got it.
Yeah.
So it is safe and it is non-toxic in the doses that we use for sort of the cosmetic or some of those other purposes. Yeah. Okay. So this one actually just came up for me because this winter has been so gray and miserable. Tanning beds are safer than the sun.
So false. Tanning beds are like way more dangerous than the sun.
Okay.
The reason for that, do you want to get into it? I guess we can talk about it all.
People want to know these things.
So, you know, I have a lot of patients who have used tanning beds. The most common thing is like the base tan before you go away or like getting ready for vacation.
Yes, exactly.
I have a lot of medical patients who use it to treat psoriasis or eczema. And, you know, maybe like we do something called phototherapy, which is a narrow band UVB. So like the two main things we think about are UVA and UVB. So phototherapy, which we use medically, is narrow band UVB. So it's, when I explain it to my patients, I'm like, it's kind of like going out in the sun and getting all the benefits, anti-inflammatory, immunosuppression effects of the sun, but with a very specific therapeutic wavelength and not all the other stuff. So we're taking out the UVA. In the case of narrowband UVB, we take out the UVA and we take out most of the UVB spectrum and just use narrowband. So sorry, I lost my train of thought.
Well, that's that's to help skin conditions.
Yes.
Right?
Yes.
So what about so like most people are going for like the tanning thing.
Correct.
So the tanning beds have both those bands.
So they actually are primarily UVA.
Got it.
So the reason that is interesting is because UVA causes skin cancer. Mm-hmm. So does UVB. But UVA is one of the big ones, like I said earlier, like the window analogy that breaks down collagen, causes signs of early aging, and then promotes skin cancer. And then UVB also can cause skin cancer or increase your risk. But UVB is the one that has a protective effect as well. Okay. So that will give you a burn, give you a tan, and all of those things are your body responding to sun to protect yourself. So you're actually just getting the bad stuff without the benefit of increasing your melanin in protection. So they're literally the worst. Tanning bed use before the age of 35 increases your risk of melanoma by 75%. I read the other day. I think that's like, yeah, I know. Okay. And another thing, well, I know it's not a tanning bed, but the other place you can get a lot of UV radiation is on a plane.
Oh, really?
Yeah. I forget. Don't quote me on this exact stat, but I think, an hour at altitude is equivalent. Like you might as well be in a tanning bed. The amount of radiation you get.
Wow. Okay.
Yeah.
See, I'm that person. I usually pick an aisle seat because now I'm in that phase of life where I have to go to the bathroom all the time.
Yes.
But I love the window on the airplane.
That's fine. Just put on sunscreen because you never think I'm getting on a plane. I need to wear sunscreen.
Yes.
But it's actually more important than just driving around on regular land.
Okay.
I try to take those little mini sunscreens that we get in the office, and then I give them to the pilot just as a reminder. I have a couple pilots that I see for skin checks, and I like now they're very well educated.
Yeah, but that's not something.
In the generation before, like very high risk of melanoma, know someone who was a pilot and had like more than 10 melanomas and other skin cancers, all on the side of the face that was in the window that, like, you know, that he flew on.
Oh my gosh, that is okay. Well,
I'm now that weirdo that's like, if someone's falling asleep and they left the window open and the sun is coming in, I'm like, do you mind just, and then if I get a word, like I'm a dermatologist, like I can back this up with evidence if needed. But,
oh my gosh, that's so funny. You should ask my husband is like, oh, you're the worst, because I'm always like, why do you pick a window seat and then close the window?
Yeah.
That's why. Okay, I won't have so much hate for that.
I have love for that.
Okay, I have love for that. I'm going to have some love. Okay. Oh, this one. Chocolate and cheeseburgers cause acne.
False. They can contribute in the sense that I'm always reminded of that commercial from our youth. I think everyone can remember that if you're in our generation. But so they don't cause acne, but in patients who are acne prone and have like usually more severe acne, simple sugars and dairy are two dietary sources that, you know, cause insulin spikes, increased insulin-like growth factor in the case of dairy especially. And there is some emerging, you know, we went through a phase actually when I was in training where it was like, no, diet doesn't affect acne that much. But now we're like, you know what, there is some evidence that it probably does, or at least exacerbates it through increased inflammation.
And interestingly, so my son didn't have a problem with acne per se, but all of a sudden he was getting like these crazy rashes on his face, and we couldn't figure it out why. Ended up going to see a dermatologist. It was because he was drinking those protein shakes, right?
Oh yeah,
which have like whey in them,
whey protein,
which is a dairy. I think
that's
it's
another
dairy
one
based.
Yes,
and so literally got off those protein shakes, and all of the rashes went away.
Yeah.
So it is. I mean, it is a thing. It's
diet is a really hard one in dermatology. I think in medicine in general, we get very little training on nutrition.
Yeah.
Like most of the stuff that I know is just from my own personal interest, stuff I learned as an athlete. So there's not a lot of evidence. Patients always come in and they're like, they want you to say like, don't eat pizza and the rash will go away. And, you know, we can't reliably, in most cases, say, cut this out and you'll be fine.
Yeah, totally.
And then some patients just go down that rabbit hole where they're doing all these crazy elimination diets and they're struggling. And because like we can't really direct them, we often say, don't worry too much about diet. Now, if you're your own investigator and you want to do that and you find that, you know, if I cut out whey, my rashes go away, then great. Like I usually say that, but I'm like, don't beat yourself up trying to find something because there might be nothing. Yeah.
And there, as you said, like there's other factors that cause acne, and we can get into some of that, like the hormonal things. Yeah. Okay, keeping going. Skin cancer is the most common cancer worldwide.
True.
Yeah.
It's non-melanoma skin cancer.
Right.
That's the most common. I mean, I see like up to like 10 of those in a morning or a day.
Mm-hmm.
Yeah.
Mm-hmm. And okay, this is the last one I'm going to do because I have so many more things that I want to talk to you about. Sleep position affects your skin.
True.
That's so funny. My friend, we were just on vacation and she showed me this pillow
to keep herself on her back.
And it looks like a little cross, and so like your face never touches anything.
Yeah.
I was like, that's funny, but it's a thing.
It's not just like that would be for like skin laxity, maybe lines, wrinkles.
Right.
If you always sleep on the same side and you're putting pressure on your skin, especially as we get older. But also, like, you know, if you're not cleaning your pillowcase or you're drooling, like you might get acne breakouts or like perioral dermatitis on that side. That's so funny. I have a friend who's like doing her very best not to get any wrinkles, and she always ends up like curled up, like with half her face smushed, and she has one line that's way worse on one side than the other. And she's like, I go to bed, I have a special pillow, I've got like pillows everywhere, and then I just wake up like this.
Maybe
You can only do so much.
I'll send you the pillow from my friend Dr. Jane. She's a GP, but she was like, look at this cool pillow I found. I'm like, that is weird. And then I was like, oh, I have a derm coming on, I'm gonna ask her about it.
Yeah.
Well, there you go.
She's got it figured out.
She does have it figured out. Okay. And the final one, and I think this is a great place to start, is, and I mentioned this kind of in the intro, but skin health is connected to overall health.
Yes, true. For sure.
So tell me about the language of our skin and what it is telling us, what it is telling us about our health. So when our skin is radiant and glowing, what is that saying? When our skin is dry, when we have breakouts, spots, all of this, what are those indicators of?
That's a good question. I feel like so many things come to mind when you say that. I mean, and then there's also just the people with like glowing, perfect skin that wash,
eat cheeseburgers and
use St. Ives scrub in the morning with a washcloth, and then they eat cheeseburgers all day, sleep on their face, and look perfect.
Right.
But I think this makes me think more like, you know, medically speaking, there's so much stuff that comes out in the skin that can be a sign of, you know, a vitamin deficiency or malnutrition, or there are some rashes that we diagnose that are come out when someone has a cancer. So like that might be the first sign that you have an internal cancer, is that you get a rash on your skin that has a certain pattern. So, you know, what's going on inside is certainly reflected in your skin. Obviously, like, you know, if your diet is slipping or you're not drinking enough water, like that affects how your skin looks and probably how you feel as well. Yeah, I don't know if that really answers the question, but I guess the other thing is you've got your primary skin diseases like eczema and psoriasis, and kind of in the opposite way, those are not only skin deep, so to speak. You know, we know that psoriasis is now linked to increased inflammation internally. So when we're treating psoriasis, we're not just trying to make someone's skin look better or feel better. We're actually like are reducing their risk of heart disease and stroke and diabetes and like all these things that come along with that type of disease. Right,
like it's more systemic.
Correct.
Yeah. And in fact, a lot of those kind of rash, like you just said, like rashes can be indicators of something beyond the skin that is happening internally. And I think that's kind of where I'm getting at is I think, you know, we say, oh, the skin is the largest organ in the body, but we kind of take that for granted, right? It's like, oh, I got, you know, a little spot here, it's dry or whatever. But it really is, at least for me, I find it is an indicator of like if something is going on. And therefore, if there is a funky rash or a weird spot or something like that, it's not something you want to ignore, right?
Yeah, totally.
So, and then as a parent of a teenager who's experiencing acne, I've learned, this wasn't a thing for me, but I've learned there's a very strong connection between our skin health and our mental health. And can you unpack that a little? Because I imagine that's a lot of what you see.
Huge. Acne is a huge and obvious one that, you know, you see people with really severe acne and you can just tell that their mood is different or they carry themselves differently. And that, I think that's one of the most rewarding conditions to treat in teens too. I mean, it's so hard to be a teenager, forget also walking around with acne on your face. So if you can get someone's acne under control and get them feeling outwardly confident, you can, like, I've seen like whole personality changes in patients like over the course of an acne treatment, which is pretty cool. So yeah, that's obvious to most people, because if you've ever had even like one pimple on your face and you feel like everyone is looking at you at right
like,
at that
not
spot.
right now, not now.
Always before it's something important too.
Totally.
Actually, I felt one coming on under my eyes. Like, oh, of course I'm getting filmed. So that's an obvious one. Another one is like psoriasis and eczema. We do clinical trials. We've started doing clinical trials in eczema and psoriasis. I would say eczema is such a big one that goes unnoticed. Because patients are what you don't see behind. So you see the rash, or you might not see a rash because they've covered it with clothing if it's not on their face. And then what you don't see is that they maybe slept for an hour the night before, or like every night for the past weeks or months. And they are exhausted. They're itchy all the time. They might be bleeding under their clothes from scratching. So that's affecting their self-esteem, their performance at work, their like all of their activities of daily living.
I can totally share personally. This is something that most people don't know about me as an adult, because it went away for me. I grew out of it. But I had like extreme eczema as a child on my hands, to the point like where it was like what you're talking about. It was like cracking and painful, and I wouldn't sleep, and it would flare up, and it was super embarrassing because it was on my hands. And so like people would, like my friends would see, be like, ew, like what is that, you know? And I'm still like super, like I want to hide my hands all the time. It's left over from that. But you're right, it's actually not something we really talk about. We talk about acne because it's so there, but eczema, psoriasis, some of those other sort of like skin, what do you call them? Disorders? Yeah. So I'm grateful to hear that you're doing some work in that area, because it was actually super traumatizing for me as a kid.
And then like the stories that come out of it, like once you, like psoriasis, I use psoriasis as an example because some psoriasis can be itchy, but sometimes it's not painful. It just looks like
angry,
impressive, I would say. Like, and so I had this one patient who had it on his lower legs for forever, and he was kind of just, you know, grumbling along, using topicals and really covering it because he couldn't feel it, but he didn't want people to see it. And so we started him on a biologic eventually for his psoriasis, and which took some I never pressure anyone to go on a medication, but he was kind of like, you know, I'm fine. Like, is it really that big of a deal? And then eventually he was like, yeah, you know what? I think I want to, like, I had been seeing him for, I was like, I think I want to try something more. I think it's time. And he came back like within 3 months. Some of these work really quickly. And he was totally clear.
Wow.
And he was so like, there was like this like joy in his eyes, and he was like, couldn't wait to tell me that he had taken his grandkids to the pool for the first time. It was like so it's so wild to think that that was restricting like such a like incredible part of his life that he was missing out on. So very cool stuff.
I love that. What are the two biggest concerns your patients come to see you about?
Skin cancer for sure is probably like the biggest part of my practice. I think that's probably anywhere you practice in dermatology, but especially in the Okanagan. And then I think acne is very common. It's probably, you know, acne often comes up as a side note. Like even if someone's not there to see me about acne, they'll bring it up. And we actually have a separate acne clinic at the office now. And just to kind of expedite some of that stuff. And then but I think eczema and psoriasis is also really common, like the immune mediated skin diseases, and we'll call them rashes. So let's unpack the skin cancer thing, because you mentioned that there's like different variants of skin cancer, and I've always heard there's like, it sounds awful, but like because there's no good cancer, but like the good one and then the not good one. So so what are the different variants of skin cancer, and what are we looking for? So like big picture, it's way more complicated than just this
the good
and
one
that.
and the bad
But
one. Yeah.
for like the sake of what's common and what we deal with the most, the good skin cancer, you're probably talking about basal cell and squamous cell carcinoma. The reason we consider by far the most, like basal cell by far the most common, squamous cell and basal cell together as non-melanoma skin cancers are like the most common cancer worldwide. So the reason we consider those to be good is that they have a lower risk of spreading, metastasizing. Usually they can be managed surgically, or
Like
there's other ways to treat it.
treated.
Yeah, locally treated
Yeah.
if we catch them. Some people could have a basal cell for years and years and just kind of acts
Sits
like
there.
a chronic wound, like it doesn't heal, doesn't go away, but isn't going on to cause more damage. Now, because there is even like a small risk of that not being, of it spreading if we leave it, and I have seen cases of metastatic basal cell and metastatic squamous cell, we treat them, obviously. Like I'm like a cautious person by nature,
For sure.
so I would rather just treat. And so that's the good cancers.
Mm-hmm.
And then there's the bad one, which is melanoma. So that's the one that when people hear skin cancer and they are scared, that's probably what they're thinking of, or they've heard a story about someone who had a funny looking mole. That's melanoma.
Right.
And the reason that one is bad is because it's a higher risk of spreading and causing, going into other organs and potentially like death. So,
and can you tell the difference between like a basal cell carcinoma and a melanoma? Like if you're just looking, like
for the
you can, but like
so yes, most of the time. Sometimes we can't. Like there's like certain types of melanoma that can look like other things. Those are more rare variants of it. But generally, melanoma will be a funny looking mole, a new mole, one that's changing. It's like, we talk about the ugly duckling sign, which is where you get this mole that looks just different from the rest of the moles on your body.
Okay.
I always remind my patients that cancer is a changing process, right? It's growing and it's evolving. So if you have something that's growing, raising up, getting wider, the borders are becoming uneven, the color is changing, or even if the color is going away from a mole, if it's got multiple colors within it, like something that looks like chaotic.
Right.
So that's more melanoma. That's like we can go through
flag.
the ABCDs of melanoma, but red flag for that. And then the basal cell and squamous cell are different. So that's where you have like a little bump that won't go away. Sometimes it looks just like a little skin colored bump. Sometimes it will start to bleed, get an ulcer.
Okay. So it's a little bit
painful.
Angry.
Yeah.
But not as
people will say,
weird.
I thought it was a pimple. A really common thing is I had a pimple and then I popped it and then it started acting funny or went away. And it was probably a basal cell the whole entire time.
Yeah.
And then they just started paying more attention to it and then it progressed.
Right. Okay. That's a really good thing to know because, we're always sort of picking at things. So if you have something that you're picking at and it's not going away, it's probably a good time to go get it checked.
Not always. I mean, you can, I have you can pick at things that are benign too, and they won't go away.
Right.
But
okay. So we've talked a little bit about cancer and the ability to treat some of these cancers if they're found early. So it's really important, I think, for all of us to hear the message that we need to be like looking.
Yes. Yeah.
And you do that at the clinic too. Somebody can come in and just be like, check me.
Yeah.
Yeah.
I mean, they can't walk in off the street.
No, I know. There's a process.
Yes. But yes, they can come in for usually they've seen their family doctor and either they have a history of cancer and then a lot of moles and it's hard or a lot of spots.
Yes.
And it's like, okay, can you just see this person? It's like overwhelming the amount of spots. Or they have one specific thing that looks funny that they want looked at. Or there's a family history and they just have never had anyone look at their skin. So there's a number of reasons that people would come in for a skin check.
Okay. And I know a lot of people are doing that now, especially we live in the Okanagan,
yes.
so it's sunny. And I'm grateful that, there's more awareness around this and that there actually are more services where you can actually go and get these things checked. So, okay. And then I just have one more question about the skin cancer thing and the sunscreen thing.
Mm-hmm.
And like, okay, so this is full disclosure. I'm sitting here. I was just in Cancun last week. So I struggle with sunscreen because we don't get a lot of vitamin D in Canada in the winter. And so I take a supplement for that. But then when I go away, I'm always like, oh, I just kind of want to soak up the sun a little bit and get that dose of natural vitamin D. So, okay. And I'm like, I know I'm talking to a dermatologist. And I know I'm like,
no, it's good. I love
rules.
this. Yeah, no.
But so I'll sit in the sun and I have a darker skin tone, which I also know doesn't matter, but
all the excuses.
I know. So I'll sit in the sun for about an hour before I put sunscreen on. I always put it on my face, but on the rest of my body so that I can get that like download of vitamin D. Can I get away with that? Are we
You
okay?
don't need to.
Okay.
I think
So
you're
I'll
using the vitamin D as an excuse to get your dose of sun. I'll
She's
explain why.
probably right.
I'll explain why, because I hear that all the time.
Yeah.
And I'm actually, maybe it's because I used to literally be in the sun all summer playing beach volleyball and have like many friends who did the same thing. And I love sun.
Yeah.
Like I like
Me too.
hate Kelowna when it gets cloudy. Like I love the sun. It's so good for mood and like overall health. I'm still super active. I'm try to be outside all the time in the summer. I just try to do it safely. I obviously think very differently now than when I was in my teens, but so vitamin D, you will actually more reliably get that from a supplement. So if you're supplementing, then you're fine. Dietary, and that's so that could be like a straight up supplement or just dietary sources that are rich in vitamin D. And then you probably don't need the sun. Like the way that we make vitamin D in our skin via the sun, or that it helps with that process, is very self-regulated. So it's not, you're maxing out at a certain point and then your body, so it's a safe way to make vitamin D in that you're not going to overdose on vitamin D.
Because your body will automatically just stop.
Shut it off.
Right.
Yeah. So that happens, like the amount of sun that you need for that to happen is like, I think like 15 to 30 minutes.
Okay.
Like a week.
Okay.
So like, like I think like 10 minutes on the back of your hands, like that surface area a day would be adequate. Okay. So we don't need it, but it feels good. So if you have to get your sun, just do it wisely.
Right.
So cover up as much as you can. There's like, we can get into a whole debate about sunscreen. Yeah. That also needs its own podcast fully. So if you're worried about covering your whole body with sunscreen, then there's great UPF clothing. There's shade. There's like early in the morning and late in the evening when the sun is not as strong. Mm-hmm. So that you could go for a walk on the beach without sunscreen, maybe if you get up super early and you have a hat on so you're not just destroying your skin.
Right. And the reasons for that aren't just like sun exposure is not great for many reasons, like skin cancer, but also aging. And like I want to talk to you about the aging stuff too, because you do a lot of really great, there's options now available to help kind of for those of us that grew up in the baby oil era.
Yeah.
But it is like, it's not like solely just about skin cancer.
No. But you see, that's where like my realistic side comes in, because a lot of dermatologists and I tell my patients like you should have sunscreen on every day, because I think that some people need to hear that. Like they need to know how important it is to regularly protect yourself from the sun. But some of that, like there's the skin cancer piece, and for me that is why my kids are like in their UPF clothing covered in sunscreen. Like I do not want them to get melanoma, and like there's evidence that a severe burn before the age of 20 like significantly increases your risk of melanoma. So there's the skin cancer piece, which is obviously so important, but if you're driving to and from work and you don't have sunscreen on and you're in the car, you're going to age more quickly. You're going to get like degradation of collagen and elastin, increased skin laxity, all of these things that people are then going and paying lots of money to reverse.
Exactly.
But if you don't care about that, then right? I'm not, and I'm just saying
totally.
like you don't have to, the obsession with sunscreen every day, every moment, always reapplying. I think a lot of that is like from the anti-aging piece as well.
Yeah.
So as long as you're being smart about sun exposure in a realistic way to prevent skin cancer, you maybe don't have to be
as extremely
correct.
Yeah.
But your skin's going to look way better if you are. Like I have a couple of patients who are like in their 50s, 60s, and their skin is unbelievable. Like I can't believe how good their skin is. And one of them is like, I just like, which is very rare for someone in that generation to have known in their youth to be wearing sunscreen. And so I was talking to her about it one time. She's like, yeah, I just like knew when everyone in my family burned. So my parents were on top of it. And then I didn't ever want to get a burn. So I've always protected my face from the sun, and it shows.
Mm-hmm.
Yeah.
Yes.
Just like healthier skin. Like she still has so much collagen.
Mm-hmm. And the loss of collagen is real.
Every
time I watch these videos, I'm like, oh boy. She's working. Can we talk a little bit about acne? Because I know that's a big thing. And I recently had the opportunity to bring my 17-year-old daughter to come see you because she's got a little bit of acne. Certainly not as serious as some cases I'm sure that you see, but enough for her to sort of be like, this is bothersome. And you and I had a really good conversation about Accutane. So I would like to go there because I know that is an area where there's maybe a lot of misinformation out there. And also it really depends on your perspective. And as a dermatologist, like what is your perspective on Accutane for, let's say, moderate to severe acne?
Yeah, we love Accutane in dermatology. I think it's such an amazing medication that can make such a difference. Obviously, there's the other side of it. It needs to be treated with respect. It's a systemic medication. There are very real side effects. I would say, I don't know how much you want to get into like the actual medicine of it, but you can't get pregnant when you're on Accutane. It has like associated with very severe fetal malformations. So in any women of childbearing potential, like we're very cautious.
Yeah.
It can also kind of affect the liver in a way that, that's one of the reasons why we do blood work. So if there are signs of the liver being irritated or unhappy, then we would
pull back.
Sometimes it's unrelated to Accutane. They maybe got a virus or they were sick. And then when you restart it, everything is fine. But like we watch carefully, we take it very seriously. But in most patients, the worst part of being on Accutane is dryness. Mm-hmm. Like just that, like the cracking lips, the dried skin, they're going to be more sensitive to the sun. Sometimes you can get like muscle aches and joint pain. But like for the most part, I've had through residency and now in my practice, I've had a lot of patients do very well on Accutane. Mm-hmm. And it's kind of like you struggle a little bit and manage the side effects while they're on it. And the nice thing about Accutane is that it's a medication that can potentially put acne into remission. Now, I won't say that is the case for everyone, but a lot of patients will go do an adequate course of Accutane and then not have to be on acne treatments again. Or maybe it's something, it comes back, but they can manage it with a topical.
And the like you said, the results I've seen, obviously, teenagers, young adults that have had really great experiences on Accutane.
Yeah.
And it's remarkable, the results.
Kind of going back to your comment earlier about self-esteem mm-hmm. and acne. So even if someone grows out of it, if you're like, why would we treat it? Maybe they'll grow out of it once they're out of their teenage years. And some people will emerge unscathed, but some will have really bad scarring. And for me, I think that's the biggest thing is like then they carry that around for the rest of their life.
And it's harder to undo.
It's so hard. And I treat acne scarring like kind of in the cosmetic side of things, although I think there's got to be like some funding for that, because it's just blows my mind like that these young kids have scarring and it's all private pay. But then you're like spending tons of money, and it's never going to be perfect. You can get some really awesome improvement with like laser technology and all of these things now, but it's just to have to go through all that if there was potentially a way to nip it in the bud and have less scarring in the end.
Because the scarring is permanent, right? And or for the most part, like you said, there's technology now, but at the same time, again, not everybody has the capacity to do that.
Correct, yeah.
But it is, I just love the way you sort of said, listen, like, you know, Accutane is a strong medication. There's no question about it. But it's a short-term duration, and the potential return on that is pretty good. Yeah. For most people. And the alternative is kind of this lifetime legacy of scarring. And so I thought that was a really good way of framing it. And still there's choice.
Yeah.
Do you know what I mean?
Totally.
Like, you don't have to do these things.
I think that's the thing for me. There's so much stigma around Accutane.
Yeah.
And if someone decides not to do it and they're like, no, this is a no-go, I want to do everything I can to try to treat my acne without Accutane, like I just always make sure to like give good education on it. And one of the other things with Accutane is there's like everybody thinks that there's a risk of increased risk of suicide because in the early studies on Accutane, there was like a couple of patients that committed suicide, but they've since done studies where it's actually shown the opposite, that it improves mood, improves confidence in patients. And so looking back at that study, if you think who was in these studies, it's like patients with the most severe acne,
right?
Who probably teenagers. Like there's so much like other stuff contributing to mental health. Now that I'm in clinical trials, I'm also like I haven't gone back and delved into that study because I think it's been disproven enough. But like some patients go on placebo,
right?
And then like I don't know what the dosing was in that study, or they also having side effects and their acne wasn't better yet. So it's so much more, and I just like the results can be so life changing.
Oh my gosh.
We're
almost like I can't even look. Okay. So I'm going to fast forward a little bit because I know that part of your practice includes the medical aesthetics part, which is kind of, you know, I know for women my age, there's all of these medical aesthetics clinics that are popping up all over the place. And it's now become a real option for women. I will say people. I don't want to just say women but people. So can you, what is medical aesthetics, like just in general? And then maybe some of the kind of more, I don't want to say popular, but treatments like that you're really excited about. Yeah.
So medical aesthetics or cosmetic dermatology for me, my practice is, you know, I don't do much of the like facials, or like I'm more in like do injectables, some injectables, we could talk more on that too. And then lasers, like a lot of energy-based devices. And that I think the energy-based device scene is what I like really excites me. And I think I think I have a different approach than a lot of other clinics and other people because of my like personal background and like my own views on health, which we've talked about, and then also my education and my experience as a dermatologist. And I just find, and I think I've seen this reflected in patients that come in, you know, so many patients come in and are like, I don't want Botox, I don't want filler. And like they almost tell me as if to say like, please don't force me to do it.
Right.
And like, I don't care. Like people can do what they want, but I think it's so interesting to see that. And, I think Botox will always be popular. Someone was asking me the other day and I was like, yeah, but it's like my guilty pleasure. There's nothing like Botox for now.
Right.
There are lasers that can do a really good job of getting rid of the wrinkles once they're there, but nothing prevents them quite the same as Botox. Filler, a lot of people, filler is getting a horrible reputation.
Yeah. We've all seen that when filler goes wrong.
Mm-hmm. I can think back to my days in residency, like medically managing some patients that had complications of filler, at another clinic, and then they got sent to our cosmetic dermatologist who also did medical and teaching. And this woman, like healthy people who had a reaction and then ended up on like 3 immunosuppressants. Mm-hmm. And so for me, like I think people are starting to realize like it's not all green in that space. And so not that things can't go wrong with lasers, but in my mind and like what I know and my analogies to like my own life and like healthy eating and exercise and lifestyle, like to me the energy-based devices are creating an injury in the skin and then using your body's own physiology, like harnessing that physiologic response to make your skin healthier.
You're hacking the system.
Exactly. It's like, I always use the analogy, I don't know if this is KGH podcast appropriate, but I'm like, I am going to go to the gym and do squats and get on the rack and suffer and do my squats.
That is the
and
analogy.
Do my lunges. I'm not going to get a butt implant because I'm going to end up, my butt's going to look better either way. But one of them is going to be a lot more functional. Yeah. And that's my bigger muscles.
It's the same theory, right?
Yeah.
So when you do load bearing exercise or weight bearing exercise, strength training, the goal actually is those little micro tears in the muscle fibers. Correct. And then the body works hard to correct that. And in turn, you get a denser muscle. Look at me trying to pretend I'm an exercise physiologist. But so when you talk about these energy-based treatments, lasers and like the needles and all of that stuff, microneedling, it's the same theory.
Yeah, it's creating a controlled injury so that your body, like the healing response is actually doing the things that we want. Once we hit our mid 30s, 40s, our collagen production just starts to go down. Mm-hmm. And so all of these things are kind of looking for ways to bring that up. And when you create a small wound or, whether that's a microscopic hole from a microneedling or like tissue ablation with like ablative lasers, your body starts that healing process. And it's not like it's a big wound that you're going to have a scar from, but it's kind of like, okay, let's make more collagen, let's make more elastin. Mm-hmm. And then you're ending up with like thicker skin, smoother skin. Like some of these things will target more like pore size, skin laxity, extra blood vessels that we have no use for except to look flushed.
Yeah. And it's interesting. Actually, I love that you're describing it that way because I'll admit I'm a little like freaked out by some of those, like just because it's like, scary, right? Needles in your face, like the lasers and all of that, and the reaction to it is actually what you want.
Correct.
But then I was just thinking, I am getting prolotherapy on my hip, which is basically the same idea. It's like you're injecting a solution into the joint to stimulate a collagen response to strengthen, in this case, the tendon there that's basically blown out.
Yeah.
So I love that you're describing it that way because I think a lot of people are a little reticent to be like, I want to try some of those interventions because it looks scary, right? But that is kind of like the point.
Like the traditional laser, like if you tell someone to say CO2 laser to someone, they're like, oh gosh, they think of like that your full face is red and scabbed and you can't go out of the house for 2 months. And so I think that's the most exciting thing.
Has technology progressed past that?
Yeah. There's that is still a thing, maybe not 2 months of downtime, but it's kind of now you have this whole spectrum. Like if you're in your 30s and you're like, I want to start doing something, but I don't have a lot of loss of skin laxity or like I don't have a lot of problems. what can I do? You do something like IPL or BBL, which is not a lot of downtime. You're still getting that light energy put into your skin, which stimulates collagen and elastin, maybe like cleans up some pigment and blood vessels, but not a lot of trauma, not a lot of downtime.
Mm-hmm.
Versus if you're like coming in and you're like in your 60s, you've never done anything and you like really need something more intense, then you're maybe going to do a resurfacing laser or not. Like usually like more intense recovery, you're going to get a more impressive result when we're talking about deep lines and wrinkles. But for things like pigmentation, like sunspots, rosacea, you can start treating those pretty gently.
And one of the things I really love about you actually is that your approach to cosmetic dermatology or medical aesthetics is pretty, I would say, conservative. Can you like sort of just expand on that?
Yeah, I would agree.
Yeah.
And I think it just comes back to like who I am.
Yeah.
Like I'm a pretty natural person. Like, you know, my daughter's lunch is, she had steamed Brussels sprouts and carrots in her lunchbox the other day. My husband and I were laughing about it. We're like, oh my gosh, she's taking an adult lunch. Like, this is not going to last much longer. She's going to start getting embarrassed. But, you know, I feel like I'm very natural and like that's like authentically comes out in my consults. And hopefully no one ever would come to see me and feel pressured. Like I have lots of people leave and I'm like, I talk too much. Obviously we're like going overtime right now, but I go overtime all the time in my consults because I just try to give so much information to people. And I think that's the biggest thing is like people come in and they're like, is she just going to tell me? Like, am I going to, sometimes when I tell people like, I don't think like we don't need to talk about filler, like, or like I don't recommend it, but this is what it is. And they like I can just like see them relax. Yeah. I'm like, we're not gonna go there. But like I just want you to know like what, because Botox and filler are not the same thing, but often talked about in the same breath. And so for me, a big part of what I do is just educating people. And then maybe they leave with like a sample of skincare, or maybe they leave with nothing and then they just think about it, and when they're ready, they decide which way they want to go.
Okay, you mentioned it, skincare routine. I have to ask because like she has the best skin ever. And I know you're a dermatologist, so it's like you have to, or maybe you don't. But what do you do? Like what is your this is like
it changes.
This is like for TikTok? Like what is your routine?
My bathroom counter is hilarious. One of my girlfriends went used my bathroom at a party once, and she came out and was like, oh my gosh, everybody has to go in there. I get like you get a lot of stuff, you get a lot of samples, and like I would like to try everything that I offer, or most of it. So I have all these like kind of like dead soldiers on my counter. Some of them are probably already expired. It changes a lot, partially because I get new stuff to try. I think generally, and then it changes by season. Like I don't really use a moisturizer in the summer. I use like a vitamin C serum or something like that will be enough for me. And then with sunscreen. My like top products would be like that I think that has the most evidence in skincare would be like an antioxidant of some kind. Okay. Vitamin C is probably like the most well known in the morning or twice a day, but like we'll say in the morning,
like
and
a
sunscreen, like a serum.
Okay.
Yeah. And then in the evening, a retinol or a retinoid product. So that's like, you know, kind of like similar to Accutane, but topical. Those have really good evidence. And then obviously like I have like my fancy washes and oil cleansers that I like try, but that's one area in my patients who are budget conscious, I often am like, okay, don't like if you have like a budget that you're trying to stick to and you can splurge on one thing, make it the vitamin C or make it the retinol if you can't handle a retinoid, which is prescription strength and can be much less expensive. Or like you need a prescription for it, but it's usually less expensive for patients. So like spend your money on the actives, because I think that's where medical grade skincare is worth it, because you know, I get asked about The Ordinary a lot, and they have some great products. And like if you're talking about like a moisturizer or like a wash or something, that's fine. But the reason their stuff is so cheap is because they like maybe don't have like, it's not preserved as long, or it's not stored as well, or it's not studied in the same way. And so that's where I tell patients like to spend on medical grade skincare.
Right. Like you don't need everything to be medical grade, but those, and I think that's really helpful because again, like I would love to have you back just to talk about that stuff because it's so confusing.
So confusing.
And it's become, skincare has become so trendy. Mm-hmm. Do you know what I mean? Like back in my day, it was like, you went to bed with your makeup on. Like, you know, like we don't do that anymore. I know some people do.
I was walking through the airport and I was in the, like going through the duty free, and I walked by the Drunk Elephant display. And they have some good stuff. But I wanted to buy it. Mm-hmm. And I like turned to my husband. I was like, this is crazy because I have so much like access to like much better stuff than that. And I'm like, it's so pretty and it's marketed that way. Like it's an addiction for sure.
It is. And I do think like, that's a whole other thing, but like, you know, it's targeted to young women who are already feeling a little bit self-conscious at that time of their life. And, you know, you see all these beautiful girls with perfect skin and it is compelling. And even like as a woman in perimenopausal kind of 40s, 50s, 60s, it's the same thing. You know, we're all sort of fighting against this ideal, right? And these products are compelling. So it's like, which ones are actually going to be like, again, not everybody can afford to have, you know, all of these medical grade products. So if we're going to be picky, where do we be picky?
Yeah.
So I think that's really, really helpful.
My only other thing I would say about skincare is like, I look for a short ingredient list. And I think like when I started my practice, that like Skin Better Science was one of the first product lines that I brought on. I have a couple other ones that I love now too, but my thing was like, I am a medical dermatologist. I wanted at least options that had no fragrance, were good for sensitive skin. Like I had one of my eczema patients was like, I just really want to try a nice cream. I want to spend the money on a nice cream, but all I can do is drugstore, which I'm like, that's fine. But she's like, no, but I want to try something. So I have products that she can tolerate. And so I love that too, because if you know, like from having eczema, like fragrance, like dyes, all these things are added, preservatives,
alcohol, anything that's
and it might even say fragrance free, but then it has like, there's like this whole list of covert fragrances which they put in as something else, but it's actually just perfume.
Amazing. I could talk to you like literally all morning. So we're going to switch gears and wrap it up. Dianne, you've been so awesome. I want to know, you know, how has your now that you've been practicing and in sort of like health and healthcare, how has your opinion or definition of what constitutes health and healthcare changed?
That's a very good question. I think a lot of it is still the same. Like I think back to me before med school and the things I cared about. And when I think of it now from the lens of where I am, I still think prevention and like, I guess prevention is a big thing. Like, why are we eating healthy? Why do I get up at 5:30?
Why do we wear sunscreen?
Yeah, exactly. So I think that has become even more obvious to me, that it's like the little things that you do day to day when you're quote unquote healthy and you have no disease that are preparing you to deal with getting cancer, wrinkles on the like total opposite ends of the spectrum. Like you, like all of these little steps you do throughout your life are setting you up to either just like live a great healthy life or be way better prepared for the challenges that come at you.
I totally agree. I don't know if you know this about me, but I think I told you, but I had breast cancer. It's almost 6 years ago now, but I really feel, and I was really mad at the time because I was like, I am like the healthiest person. I don't eat bacon and I do yoga and like all these things. But then I realized that a lot of the things that I had been doing already in my life set me up to be able to handle that and navigate that and also catch it early. Do you know what I mean? So this hyper awareness around, I don't think it's a bad thing. I mean, I'm a hypochondriac now, admittedly, but the awareness around, we have to be sort of like our own advocates and the like in the driver's seat for our own health. You know, you talked a lot about like, it's not just the cream and it's not just the, you know, we have to check our skin. We have to wear the sunscreen. We have to eat the right things and sleep well. And all of these things contribute to our overall health. Right.
And if you're doing the things, if you're putting the fuel into your body, you're exercising, you like have a sense of how you feel and you know yourself well, right? So when you feel a bit off, you're like, why am I like tired? I'm not sick. Like, do I need to see someone about that? Or like, why is my skin acting like this? Like I've been doing all the things. Yeah, exactly. Like you said, you're going to catch stuff earlier. You're going to just be so much more in tune with yourself. And then if something like that happens, which you could be the healthiest person and still happens. Like I see like in my melanoma patients all the time, but you're starting that journey of whether is that like a surgery or chemotherapy, radiation, you're like starting up here instead of starting down here.
Totally.
And sometimes it takes a diagnosis of cancer for people to change,
to wake up,
and they come out stronger, but like you're just way better set up for any challenge.
Yeah, I totally agree. And it's what we hear over and over again on this podcast. You know, it's why we've called it Wealthy, because like really health is integrated. It's not just one thing. It's the collection of all of the different activities and efforts that we make in all areas of our life that contribute to overall wellness. Okay, so I'm going to ask you, last question. What areas, so this is called the Wealthy Podcast. We have our own definition that health is wealth. What areas of your life do you feel wealthy or abundant?
I think my health and my family. I don't know. I'm like in a I know it's 2025 is hitting people differently, but I just feel like I entered 2025 feeling so grateful about like my family. I have 2 little kids who are just the best, and like we got to spend so much time together. I had like a very unexpected 2 weeks, or like, you know, I never get 2 weeks off to spend with them, and just feel so rich in my personal life. And like with like I have a great relationship with my husband and kids, and we're like a really tight unit, and then we have so many great friends. Just feel maybe it's like my people that I feel the most wealthy.
That's great.
And I feel good. I feel healthy. I'm like committed to a good lifestyle and exercise and diet, and
awesome. Well, I feel like I still have like 3 pages of questions that I didn't even get to. This was awesome. You are just a really lovely example. You kind of practice what you preach, and very, very genuine. And I just really appreciate you coming and sort of sharing all of your knowledge and just being so authentic. So thank you, Dianne.
Thanks for having me. I feel the same about you. Obviously, you're the best.
Oh.